My name is Diane, and I recently had a discectomy and laminotomy at the New Jersey Spine Institute with Dr. James Dwyer. Throughout my life, I've always been a really active person, and my family has as well. We hike, we camp, we ski, snowshoeing, you name it. We're just very active. In fact, I spent 20 years working with the horse farms through New Jersey, whether it was managing them or training them, and it was very physical, and I loved it, kept me in great shape. But I guess I've always had some low-level issues with my back. I had seen a chiropractor probably since the age of 18, but just kept me going, kept me riding, kept me safe and comfortable. Nothing that Advil and a couple adjustments couldn't take care of. And then fast forward 10, 20 years, and it hit me really hard one day just by sneezing, and it knocked me to my knees, and I pretty much stayed on the floor for 9 days, and I realized this was much more serious than the chiropractor could handle, and I needed to see somebody. So once I've recognized now that this pain is serious and probably beyond anything I've ever experienced, I decided I'm going to start researching this online because I really couldn't do anything else. And as a nurse by trade, and I research things all the time for my patients, I just hit the internet and started reading about what could possibly be going on and causing this intense pain. And as I'm looking through the articles, there was an ad in the sidebar for the New Jersey Spine Institute, and I realized they were in Bedminster, which is pretty close to where I live. Read a little bit about the doctors, liked what I read, but then also remembered that I have a friend who works in Bedminster as a physical therapist, so I quickly gave her a call, and she agreed that these guys were the best, and so I decided I had to give them a call. When I called them up, I was able to explain to them what happened, and obviously she knew how terrified I was, and they were able to see me fairly quickly, and so my husband and I got down to the office and met Dr. Dwyer and the staff. Wonderful staff, very kind, and working in the healthcare profession, it was really nice to see a very well-run practice. I appreciated that. And Dr. Dwyer was just so professional and kind, good listener, and did an assessment on me that was very to the point. Was very concerned that I had a herniated disc, but said, yes, we'll verify this through MRI. And I was terrified, and he did mention that we could go with injections to see if I could get relief, which I said okay, because I knew I had to do something at this point. He mentioned surgery, which I kind of blew off because that wasn't in my vocabulary as a healthy, active person. He instilled a lot of confidence, not only in me, but also in my husband, which was really important. Just a very confident nature explained to me that this is what he does multiple times a day, all week long, and really instilled confidence in me that this was probably the guy I should be with. So long story short, the MRI did verify a herniation, and we set up an appointment to have an injection. The injection did not give me as much relief as he had hoped, and really didn't see a use to go forward with additional injections because it just didn't look like it was going to be something that was going to help. So we scheduled surgery, which again terrified me. I cried. But it happened quickly, and I was able to get the surgery, and he assured me that when I woke up I would be pain-free. And for some unknown reason, I trusted him and believed that that was going to be the case, and it was. So after the surgery, I woke up, groggy of course, and went through the recovery room process, and noticed I did not have that pain that was going down my leg for the last couple of weeks. The burning sensation was gone. And I was thinking, well, it's probably the anesthesia still wearing off, and got myself up. We got out of recovery. My husband drove me home, and came home with some pain medications and was waiting to know when to take them, and the pain wasn't coming back, which was refreshing. And I kept waiting, and I took a couple Motrin just to make sure, and I never got the pain back. It was gone from the moment I woke up. And the only pain I had was from the incision, which is to be expected. And I just kept doing the exercises and walking as much as I could, a little bit more every day, a little bit longer every day, and got better and better to where today I'm doing everything I need to do. I'm gardening like crazy. I walk the dogs several miles every day. We just went cross-country skiing last weekend because we had great snow. I snowshoe like crazy when there's snow. I'm just a real active person, and I am so grateful to be able to be back to doing the things that I love to do.